Question 1. A practical nurse is caring for a client with heart failure who reports increasing shortness of breath, particularly when lying flat. The nurse notes bilateral pitting edema in the ankles and crackles in the lung bases. Which of the following is the most appropriate initial nursing intervention? A. Administer a prescribed PRN diuretic and monitor urine output. B. Encourage the client to ambulate frequently to improve circulation. C. Elevate the head of the bed to a semi-Fowler's or high Fowler's position. D. Obtain a stat chest X-ray to assess for pulmonary effusion. Answer: C. Elevate the head of the bed to a semi-Fowler's or high Fowler's position. This question tests prioritization and immediate intervention for respiratory distress in a client with heart failure. The keywords most appropriate initial nursing intervention and symptoms like increasing shortness of breath and crackles in the lung bases point to a need for immediate action to improve breathing. Elevating the head of the bed to a semi-Fowler's or high Fowler's position helps reduce venous return to the heart, eases lung expansion, and significantly improves breathing comfort by reducing the effect of gravity on fluid accumulation in the lungs. While a diuretic is important for fluid overload, and further diagnostics like a chest X-ray might be needed, ensuring the client can breathe comfortably and safely is the absolute first priority before administering medication or waiting for tests. Remember, always address ABCs, airway, breathing, circulation, first in acute situations. Question 2. A practical nurse is preparing to administer an opioid analgesic to a client post-surgery. Before administration, the nurse notes the client's respiratory rate is 8 breaths/minute. The client is drowsy but rousable. What is the nurse's priority action? A. Administer the opioid as prescribed and continue to monitor respiratory rate closely. B. Hold the medication and notify the registered nurse, RN, or physician immediately. C. Administer a reduced dose of the opioid to prevent respiratory depression. D. Document the finding and reassess the client in 30 minutes. Answer: B. Hold the medication and notify the registered nurse, RN, or physician immediately. This question focuses on medication safety, specifically regarding opioid administration and recognizing adverse effects. The critical keyword is priority action in response to a significantly low respiratory rate, 8 breaths/minute, which is a key indicator of opioid-induced respiratory depression. Administering the opioid would further depress respirations and is contraindicated. The practical nurse must prioritize client safety by holding the medication and immediately escalating the concern to the RN or physician who can assess the client and determine the appropriate intervention, such as administering an opioid antagonist if necessary. Always prioritize client safety, and never administer a medication when a serious adverse effect is already present or highly likely. Question 3. A practical nurse is reinforcing teaching with a client newly diagnosed with type 2 diabetes about foot care. Which statement by the client indicates a need for further teaching? A. I should inspect my feet daily for cuts, blisters, or sores. B. I will wear new shoes all day to break them in quickly. C. I should avoid walking barefoot, even indoors. D. I will keep my toenails trimmed straight across. Answer: B. I will wear new shoes all day to break them in quickly. This question tests knowledge of client education for diabetes management, specifically foot care. The keyword indicates a need for further teaching requires identifying the incorrect statement. Wearing new shoes all day to break them in quickly is dangerous for diabetic clients because it can lead to friction, blisters, and skin breakdown before the shoes are properly molded to the foot, potentially causing non-healing ulcers due to impaired circulation and neuropathy. Diabetic clients should break in new shoes gradually, wearing them for short periods initially. The other options describe correct foot care practices, such as daily inspection, avoiding bare feet, and trimming nails straight across, all aimed at preventing injury and infection. Question 4. A practical nurse is assisting with the care of a client with Clostridioides difficile, C. diff, infection. Which personal protective equipment, PPE, is most essential when providing direct client care? A. N95 respirator and gloves. B. Surgical mask and gown. C. Gown and gloves. D. Eye protection and face shield. Answer: C. Gown and gloves. This question focuses on infection control and the appropriate use of personal protective equipment, PPE, for specific infections. C. Diff is primarily transmitted through the fecal-oral route and requires contact precautions. The keywords most essential and direct client care indicate the primary barriers needed to prevent direct contact with the infectious agent. A gown protects the nurse's clothing from contamination, and gloves protect the hands. Hand hygiene with soap and water, not alcohol-based hand rub, is also crucial after removing PPE due to spore formation. While other PPE might be used for specific procedures, a gown and gloves are the fundamental requirements for contact precautions. Question 5. A practical nurse is caring for an older adult client who becomes confused and attempts to climb out of bed, despite having bed rails up. The client is at high risk for falls. Which nursing intervention is most appropriate to ensure client safety? A. Apply wrist restraints to prevent the client from getting out of bed. B. Request a physician's order for a sedative medication to calm the client. C. Place the client in a room closer to the nursing station for increased observation. D. Move the client to a bedside chair with a lap belt to prevent falls. Answer: C. Place the client in a room closer to the nursing station for increased observation. This question addresses client safety and fall prevention, particularly in a confused older adult. The keywords most appropriate and high risk for falls emphasize finding the safest and least restrictive intervention. Restraints, physical or chemical, should be a last resort after less restrictive measures have failed, and they require strict protocols due to potential harm and ethical considerations. Moving the client closer to the nursing station allows for more frequent and direct observation, which can help prevent falls by allowing nurses to intervene quickly when the client attempts to get out of bed, often before a fall occurs. It is a proactive, non-pharmacological, and non-restrictive approach to enhancing safety through increased vigilance. Question 6. A client who has undergone a total hip arthroplasty earlier today reports a sudden, sharp pain in the operative hip, accompanied by a popping sensation. The practical nurse notes the affected leg appears shorter and internally rotated. What is the immediate nursing concern? A. Deep vein thrombosis, DVT. B. Hip dislocation. C. Wound infection. D. Numbness due to nerve impingement. Answer: B. Hip dislocation. This question tests the practical nurse's ability to recognize critical post-operative complications. The keywords sudden, sharp pain, popping sensation, leg appears shorter, and internally rotated are classic signs of a hip dislocation after total hip arthroplasty. This is an orthopedic emergency that requires immediate attention from the healthcare team to prevent further damage and alleviate severe pain. While DVT and wound infection are potential postoperative complications, their symptoms differ, and they do not typically present with the acute mechanical signs described. Recognizing these specific signs quickly is crucial for client safety. Question 7. A practical nurse is documenting an incident where a client refused a prescribed medication. Which of the following details is most important to include in the documentation? A. The nurse's personal opinion about why the client refused. B. The specific medication, dose, route, and time it was offered. C. A statement that the client is being uncooperative. D. The The nurse's assumption of the client's motivation for refusal. Answer B. The specific medication, dose, route, and time it was offered. This question focuses on accurate and objective nursing documentation. When a client refuses medication, the most important details to document are factual, objective data. This includes the precise medication, dose, route, and the exact time it was offered, as well as the client's stated reason for refusal, if any, and the notification of the healthcare provider. Documenting personal opinions, judgmental statements like uncooperative or assumptions about client motivation is subjective and inappropriate, as it does not reflect professional, factual charting. Comprehensive and objective documentation is crucial for legal protection, continuity of care, and effective communication among the healthcare team. Question 8. A practical nurse is providing discharge teaching to a client with chronic obstructive pulmonary disease, COPD. Which statement by the client indicates effective understanding of self-management strategies? A. I will increase my oxygen flow rate if I feel short of breath. B. I will avoid getting flu shots because they might make me sick. C. I will try to conserve my energy by pacing activities throughout the day. D. I should expect to gain weight as my breathing improves. Answer C. I will try to conserve my energy by pacing activities throughout the day. This question assesses the practical nurse's ability to evaluate client understanding of chronic disease management. The keyword effective understanding requires identifying the correct self-management strategy for COPD. Clients with COPD often experience dyspnea, shortness of breath, and fatigue, so pacing activities and conserving energy are crucial strategies to manage symptoms and maintain activity levels without exacerbating breathing difficulties. Increasing oxygen flow without a physician's order can be dangerous for COPD clients due to the risk of respiratory depression. Flu shots are vital for preventing exacerbations, and weight gain is not a typical expectation for improved breathing in COPD. Rather, maintaining a healthy weight is important. Question 9. A practical nurse is preparing to insert a peripheral intravenous catheter for a client requiring fluid hydration. Which action is most critical to perform immediately before inserting the catheter? A. Apply a warm compress to the chosen insertion site. B. Shave the hair around the insertion site. C. Apply a tourniquet and palpate for a suitable vein. D. Explain the procedure to the client and obtain informed consent. Answer D. Explain the procedure to the client and obtain informed consent. This question tests the understanding of fundamental nursing principles, specifically client rights and safety before a procedure. The keyword most critical to perform immediately before highlights the importance of the initial steps. Obtaining informed consent and providing a clear explanation of the procedure ensures the client understands what will happen, why it's necessary, and has the right to refuse, upholding ethical principles like autonomy. This step must precede physical preparation or intervention. While the other options are part of the insertion process, explaining the procedure and obtaining consent is a foundational and ethical prerequisite before any invasive intervention is initiated. Question 10. A practical nurse observes an unregulated care provider, UCP, using incorrect body mechanics while assisting a client with ambulation. What is the most appropriate action for the practical nurse to take? A. Immediately report the UCP to the unit manager for unsafe practice. B. Correct the UCP's technique at the moment and provide guidance. C. Document the incident in the client's chart as a safety concern. D. Avoid intervening, as it is the UCP's responsibility to know proper technique. Answer B. Correct the UCP's technique at the moment and provide guidance. This question assesses the practical nurse's role in supervision and ensuring client and staff safety. The keyword most appropriate action directs towards a timely, constructive, and educational approach. Witnessing incorrect body mechanics poses an immediate risk of injury to both the client and the UCP. The practical nurse's role includes supervising and guiding UCPs. Directly and immediately correcting the technique provides immediate risk reduction and a learning opportunity, which is more effective than waiting to report or just documenting. This direct intervention supports a safe working environment and promotes best practice. Question 11. A practical nurse is reviewing a client's medication administration record, MAR. The client is prescribed a medication that is known to cause orthostatic hypotension. What instruction is most important for the practical nurse to provide to the client regarding this medication? A. Take this medication with food to prevent stomach upset. B. Limit your fluid intake to prevent fluid retention. C. Change positions slowly, especially when getting up from lying or sitting. D. Report any increase in appetite or weight gain to the nurse. Answer: C. Change positions slowly, especially when getting up from lying or sitting. This question tests medication safety and client education, specifically anticipating and preventing adverse effects. The key phrase orthostatic hypotension refers to a sudden drop in blood pressure upon standing, leading to dizziness or fainting. The most important instruction is directly related to managing this specific side effect. Advising the client to change positions slowly allows the body to adapt to the change in blood pressure, reducing the risk of dizziness and falls. The other options are general medication instructions or relate to different side effects, not specifically orthostatic hypotension. Always educate clients on how to recognize and manage potential side effects of their medications. Question 12. A practical nurse is caring for a client who is NPO, nothing by mouth, for an upcoming surgical procedure. The client repeatedly asks for a drink of water, stating they are very thirsty. What is the most appropriate nursing response? A. I understand you're thirsty, but it's important to keep you NPO for your safety. B. Just a small sip won't hurt, as long as you don't tell anyone. C. I will ask the doctor if you can have some ice chips instead. D. You can have water after your surgery is complete. Answer: A. I understand you're thirsty, but it's important to keep you NPO for your safety. This question assesses therapeutic communication and adherence to NPO status for client safety. The most appropriate response is empathetic yet firm, prioritizing the client's safety. Explaining the rationale for your safety helps the client understand the importance of remaining NPO, which prevents aspiration during anesthesia. Offering a small sip or suggesting ice chips without an order is a breach of protocol and could endanger the client. Telling them they can have water only after surgery is true but lacks the immediate empathetic validation and safety explanation required for the present moment. Always explain the why behind restrictions, linking it to their well-being. Question 13. A practical nurse is assessing a client's wound that was surgical debrided for pressure injury. The nurse observes thick, yellow-green drainage with a strong foul odor. Which action should the nurse take first? A. Document the findings in the client's chart. B. Obtain a wound culture as prescribed. C. Notify the primary care provider, PCP, about the wound appearance. D. Cleanse the wound with sterile saline. Answer: D. Cleanse the wound with sterile saline. This question tests the practical nurse's immediate action regarding wound care assessment. The key phrase, thick, yellow-green drainage with a strong foul odor, strongly suggests a wound infection. While documenting, culturing, and notifying the PCP are all important, the first action is typically to cleanse the wound. Cleansing the wound removes exudate, reduces bacterial load, and allows for a more accurate assessment of the wound bed. This immediate step also prepares the wound for any further interventions, such as obtaining a culture, and is an essential component of wound management before escalating concerns. Question 14. A practical nurse is caring for a client who underwent abdominal surgery 24 hours ago. The client reports pain at an 8 out of 10 on the pain scale, is restless, and is reluctant to move. The client has a PRN order for hydromorphone 0.5 mg for push every 4 hours for severe pain. What is the most appropriate action for the practical nurse? A. Encourage the client to use deep breathing exercises and reposition. B. Administer the prescribed hydromorphone as ordered. C. Notify the physician that the client is experiencing severe pain. D. Assess the client's vital signs and level of consciousness. Answer: B. Administer the prescribed hydromorphone as ordered. This question assesses pain management and prioritization in post-operative care. The critical information is the client's pain level, 8/10, their restlessness, reluctance to move, and the presence of a PRN order for an opioid analgesic. The most appropriate action is to administer the medication that is already prescribed and available to manage severe pain. While assessing vital signs is important, and encouraging non-pharmacological methods can be adjuncts, severe pain requires pharmacological intervention as the priority. Notifying the physician without first attempting the available prescribed medication would delay relief unnecessarily. Effective pain management facilitates client recovery and mobility. Question 15. A practical nurse is educating a client about new colostomy care. Which statement by the client indicates a need for further teaching? A. I should empty my colostomy bag when it is about 1/3 full. B. I can eat whatever I want now that I have a colostomy. C. I will clean the skin around my stoma gently with warm water. D. I need to watch for any changes in the color or size of my stoma. Answer: B. I can eat whatever I want now that I have a colostomy. This question tests understanding of colostomy care and nutritional considerations. The keyword indicates a need for further teaching points to an incorrect or unsafe statement. While clients with a colostomy generally have fewer dietary restrictions than those with an ileostomy, stating, "I can eat whatever I want" is an overgeneralization that can lead to problems. Clients should be taught to reintroduce foods gradually, identify trigger foods that cause gas or constipation, and ensure adequate hydration to prevent complications. The other options reflect correct colostomy care practices, such as timely emptying, gentle skin care, and monitoring the stoma for changes. Question 16. A practical nurse is caring for a client who is receiving intravenous, fluids. The nurse notes swelling, pain, and coolness at the insertion site, and the infusion rate has slowed significantly. What complication does the nurse suspect? A. Phlebitis. B. Infiltration. C. Infection. D. Air embolism. Answer: B. Infiltration. This question assesses the practical nurse's ability to identify for complications. The described symptoms, swelling, pain, coolness at the site, and a slowed infusion rate, are classic signs of infiltration. Infiltration occurs when the fluid leaks out of the vein and into the surrounding subcutaneous tissue. Phlebitis involves inflammation of the vein, typically presenting with redness, warmth, and a palpable cord. Infection would involve warmth, redness, pus, and fever. An air embolism is a systemic complication with different acute respiratory and circulatory symptoms. Recognizing these distinct signs is crucial for prompt intervention and preventing further tissue damage. Question 17. A practical nurse is preparing to administer insulin to a client. The client's blood glucose reading is 3.2 millimoles per liter. The client is awake but diaphoretic and slightly shaky. What is the priority action for the practical nurse? A. Administer the prescribed insulin. B. Give the client a carbohydrate snack, such as orange juice. C. Recheck the blood glucose level in 15 minutes. D. Notify the physician immediately. Answer B. Give the client a carbohydrate snack, such as orange juice. This question tests the practical nurse's response to hypoglycemia. The key phrases blood glucose reading is 3.2 millimoles per liter and diaphoretic and slightly shaky indicate the client is experiencing hypoglycemia, low blood sugar, which is a medical emergency. The priority action is to immediately administer a fast-acting carbohydrate, such as orange juice, to rapidly raise the blood glucose level. Administering insulin would further lower blood glucose and is contraindicated. While rechecking blood glucose and notifying the physician are important next steps, the immediate goal is to treat the hypoglycemia to prevent progression to more severe symptoms like loss of consciousness or seizures. Question 18. A practical nurse is caring for a client admitted with an exacerbation of congestive heart failure, CHF. The client suddenly becomes severely dyspneic, restless, and has pink, frothy sputum. Which of the following conditions does the nurse suspect? A. Pneumonia. B. Pulmonary embolism. C. Acute pulmonary edema. D. Myocardial infarction. Answer C. Acute pulmonary edema. This question assesses the practical nurse's ability to recognize life-threatening complications. The combination of severely dyspneic, restless, and pink, frothy sputum in a client with CHF is highly indicative of acute pulmonary edema, a medical emergency caused by excessive fluid accumulation in the lungs. This condition results from severe left-sided heart failure. While pneumonia, pulmonary embolism, and myocardial infarction can cause dyspnea, the specific presentation of pink, frothy sputum is a hallmark sign of pulmonary edema. Prompt recognition is critical for immediate medical intervention to improve oxygenation and remove fluid. Question 19. A practical nurse is explaining to a client how to collect a clean catch urine specimen. Which instruction is most important for the nurse to provide to ensure an accurate specimen? A. You can collect the specimen at any time of day. B. Void a small amount into the toilet first, then collect the middle portion. C. You can use any clean container to collect the urine. D. Collect the entire urine stream in the specimen cup. Answer B. Void a small amount into the toilet first, then collect the middle portion. This question tests knowledge of diagnostic specimen collection techniques. The keyword most important when collecting a clean catch urine specimen emphasizes the technique that minimizes contamination. Instructing the client to void a small amount into the toilet first, to flush out microorganisms from the urethra, and then collecting the midstream portion ensures the specimen is primarily from the bladder, providing a more accurate representation for culture and sensitivity tests. Collecting the entire stream or using an unsterile container would increase the risk of contamination, leading to inaccurate results. Question 20. A practical nurse is caring for a client with a new tracheostomy. Which nursing action is most critical to ensure airway patency? A. Providing frequent oral hygiene. B. Assessing stoma site for redness and swelling. C. Performing tracheostomy suctioning as needed. D. Applying a tracheostomy dressing every shift. Answer C. Performing tracheostomy suctioning as needed. This question focuses on airway management, a fundamental and critical aspect of client care, especially with a tracheostomy. The keyword most critical action to ensure airway patency points directly to suctioning. A tracheostomy bypasses the upper airway's humidification and filtration mechanisms, leading to increased mucus production. Secretions can quickly block the airway, making suctioning essential to clear the airway and prevent respiratory distress. While oral hygiene, stoma assessment, and dressing changes are important components of tracheostomy care, Ensuring a clear airway through suctioning takes priority to prevent life-threatening obstruction. Question 21. A practical nurse is contributing to the care plan for a client with a history of recurrent urinary tract infections, UTIs. Which dietary recommendation should the nurse include to help prevent future UTIs? A. Increase intake of acidic foods like citrus fruits. B. Drink at least 2 to 3 liters of water daily. C. Limit consumption of cranberry juice. D. Consume more dairy products to balance pH. Answer: B. Drink at least 2 to 3 liters of water daily. This question tests knowledge of preventative measures for common health conditions, specifically UTIs. The most effective and universally recommended dietary intervention for preventing recurrent UTIs is to increase fluid intake, specifically water. Drinking at least 2 to 3 liters of water daily helps flush bacteria from the urinary tract, reducing their ability to adhere and cause infection. While cranberry products are often suggested, evidence supporting their efficacy is mixed, and they are not a substitute for adequate water intake. Increasing acidic foods or dairy products does not reliably prevent UTIs. Question 22. A practical nurse is providing wound care for a client with a pressure injury. The nurse notes purulent drainage and increased redness around the wound. The client's temperature is 38.5 degrees Celsius. What is the most appropriate initial nursing action? A. Apply a warm compress to the wound to promote drainage. B. Document the findings and continue with the dressing change. C. Obtain a wound culture and notify the primary care provider. D. Increase the frequency of dressing changes. Answer: C. Obtain a wound culture and notify the primary care provider. This question requires the practical nurse to identify signs of infection and prioritize appropriate action. The keywords purulent drainage, increased redness, and a client temperature of 38.5 degrees Celsius all strongly indicate a wound infection. While documenting is always necessary, and continued dressing changes are part of care, the immediate priority is to obtain a wound culture to identify the causative organism and then promptly notify the primary care provider, PCP, so that appropriate antibiotic therapy can be initiated. Applying a warm compress is not the primary intervention for a suspected infection, and increasing dressing changes alone will not resolve the infection. Question 23. A practical nurse is preparing to administer medications to a client who has difficulty swallowing pills. The client has a prescribed tablet that is not crushable. What is the most appropriate action for the practical nurse? A. Crush the tablet and mix it with applesauce to facilitate swallowing. B. Notify the primary care provider to request an alternative formulation or route. C. Instruct the client to try swallowing the pill with a large amount of water. D. Skip the dose and document client unable to swallow pill. Answer: B. Notify the primary care provider to request an alternative formulation or route. This question tests medication administration safety and problem solving when a client has difficulty swallowing. The critical information is that the tablet is not crushable, which implies it is an extended-release, enteric-coated, or sublingual medication that would lose its therapeutic effect or become harmful if crushed. The most appropriate action is to advocate for the client by notifying the primary care provider to request a different formulation, e.g., liquid, transdermal patch, or an alternative route of administration. Crushing a non-crushable tablet is a medication error. Simply documenting the skipped dose without seeking an alternative means the client does not receive necessary medication. Question 24. A practical nurse is assessing an older adult client who reports a sudden onset of confusion, frequent urination, and a burning sensation during urination. The client does not have a fever. What condition should the nurse most suspect? A. Dehydration. B. Urinary tract infection, UTI. C. Dementia progression. D. New onset diabetes mellitus. Answer B. Urinary tract infection, UTI. This question focuses on recognizing atypical presentations of common conditions in older adults. The keywords are sudden onset of confusion along with frequent urination and burning sensation during urination. In older adults, UTI is often present with altered mental status, confusion or delirium, as the primary symptom, sometimes without a fever. While the other options could cause some of these symptoms, the constellation of confusion combined with specific urinary symptoms, frequency, burning, strongly points to a UTI. It is crucial to recognize these subtle signs in the elderly to ensure prompt diagnosis and treatment. Question 25. A practical nurse is monitoring a client who received a blood transfusion 1 hour ago. The client suddenly develops hives, itching, and a feeling of warmth. What is the immediate priority nursing action? A. Administer an antihistamine as prescribed. B. Slow down the blood transfusion rate. C. Stop the blood transfusion immediately. D. Recheck the client's vital signs and compare to baseline. Answer C. Stop the blood transfusion immediately. This question tests the practical nurse's response to an acute adverse reaction during a blood transfusion, a critical safety scenario. The symptoms, hives, itching, feeling of warmth, indicate a possible allergic reaction or other transfusion reaction. The immediate priority nursing action in any suspected transfusion reaction is to stop the transfusion immediately to prevent further exposure to the reacting agent. After stopping the transfusion, the nurse would then maintain access with normal saline, assess vital signs, notify the physician and blood bank, and administer any ordered medications like antihistamines. Stopping the transfusion takes precedence to ensure client safety.